And if you suffer from pain in your hands or feet, it could be the result of a rare type of tumor that can go undiagnosed for years. Dr. Michael Kim joins us live in the studio to explain. So, Dr. Kim, what is a glomus tumor?
So a glomus body is a special nerve organ in your fingers and toes that regulate temperatures, so they open and close. You can see an MRI showing the little tumor.
Yeah.
And what's interesting about these tumors, they're very rare, but when I see them about once a year, these patients have been walking around for years with this severe pain in their finger or toes, and no one can make the diagnosis. You know, they walk around and say, I can't touch my finger, you know, I put my hand in cold water and it hurts, which is diagnostic. And people think they're crazy. They, you know, the last patient was 10 years, you know, going to doctor, and everyone says you're crazy, you know, you just have I can't see anything in your finger. If you order the MRI, you'll see the little tumor, and if you cut it out, they're cured. So luckily, they're very rarely malignant. They're usually benign, but they can be very debilitating.
Yeah, and it can probably drive people a little crazy, wondering what's going on with their hands and their feet. So what happens if something like this isn't, you know, treated, and what are we looking at here right now? So is this a sign of?
Yeah, so commonly they occur in the fingertips or under the nail. So a lot of people will have this little bluish tinged tumor under their nail, and you might not even see it originally, but you just can't touch the nail. It just hurts. And so people present saying that, you know, I can't touch this finger. It just hurts every time I use it. Just severe pain. Wash my hands. It hurts, and you can't see anything. And if you don't know about this tumor, you would think the patient's crazy. So, often, you know, I see patients who've been, you know, going from doctor to doctor, and they can't figure it out. But if you know about it, then the minute I hear about their complaints, I say, glomus tumor. You get the MRI, and it's consistent with it. You cut it out, and they're fine. So it's just something to throw out there to if patients may be running around with this thing, to realize that they're not crazy, and this is a tumor that's not terribly uncommon and can be cured.
All right, so it's good to know that there is treatment and surgery is necessary, which some of the photos are too gruesome, but we actually have a photo of just the bruising afterwards that we can go ahead and see. So is it something that is a lot of recovery time on it?
No, it's something I can do in the local anesthesia, just numb up the finger, cut out tumor, less than 30 minutes. Usually recover is not bad, just a little bandage, and they can use their hand right away or their toe. So it's a relatively minor surgery for something that could be very debilitating.
And what could happen if it wasn't treated?
If they are malignant, which is also very rare, luckily, I mean, obviously amputation is possible. But for the most part, local excision, just simple cutting a little tumor out, a couple of stitches, cures the problem. Very simple, very minimal recovery, and it's great.
All right, Dr. Kim, thanks for being here today.